I'm Sarah, a rheumatology clinical specialist nurse, and today I'm going to talk to you about starting Belimumab. Whether you're new to this treatment or just want more information, this video will help you understand how Belimumab works, what to expect, and how to manage your treatment. You can watch this video as many times as you need to. You'll have an appointment with one of our specialist nurses to make sure that you've understood the information and to answer any questions you might have. Belimumab is a type of medication called a biologic therapy. For more information, you can watch our video by nurse specialist Jan Ball talking about general biologic therapies. Belimumab is a medication used to treat certain autoimmune conditions, such as systemic lupus erythematosus and lupus nephritis. These conditions occur when your immune system mistakenly attacks your own tissues, causing inflammation and damage. Belimumab works by reducing the activity of B cells, which are part of the immune system, and this helps reduce inflammation and symptoms of lupus. Belimumab can be given in two ways, either as an infusion or as an injection just under the skin. If you're receiving an infusion, they are initially given every 2 weeks for the first 3 doses and then every 4 weeks after that. Infusions are given at the hospital in our Biologics Day unit and usually take an hour. If you're using the subcutaneous injections, you can do this at home. You'll need to inject it usually every week, and the home care nurse will show you how to do this properly. As with any medication, you might be wondering what to expect when you start this new treatment. Most people tolerate the medication well, but some people may experience some side effects. The most common side effects include mild reactions at the infusion or injection site, such as redness, swelling, or discomfort, headaches, nausea, fatigue, or infections like a cold. Rarely it can cause serious infections, so it's important to be aware of any signs of infection like fever, persistent cough, or feeling unusually tired. If you notice any of these symptoms, please seek medical advice or assistance. Don't forget that you can also pick up infections through food. While rare, some people may experience more serious side effects, such as allergic reactions or mood changes like depression or suicidal thoughts, and progressive multifocal leukoencephalopathy, which can affect your brain and nervous system. Please report these immediately if they occur. While you're on Belimumab, you'll need regular blood tests to monitor your white blood cell counts and your liver and kidney function. This is because Belimumab can affect these levels. These blood tests should be done 3 monthly to make sure everything is on track. Sometimes you may need to have your bloods checked more frequently than this. It's important to attend these appointments to keep your treatment safe and effective. Since Belimumab can weaken your immune system slightly, you'll want to avoid live vaccines while taking it. However, it's a good idea to stay up to date with yearly flu vaccines and other recommended vaccines such as COVID, pneumococcal, non-live shingles and the RSV vaccine if appropriate. If you're planning to have an operation, you may need to stop the Belimumab for a time before and after the surgery. The decision will be based on the timing, how you received the Belimumab and the type of surgery you're having. Belimumab should be avoided during pregnancy as there's limited information available about the effects of Belimumab in pregnancy and on the unborn child. Women who could become pregnant should use effective contraception while being treated with Belimumab and for 4 months after stopping treatment. There is currently no information available on the possible effects of Belimumab on male and female fertility. To get the most out of Belimumab, it's important to stay consistent with your treatment plan. If you're using the injection form, try and set reminders to keep a treatment schedule to make sure you don't miss a dose. Also, always report any unusual symptoms. For example, if you develop signs of an infection or feel unwell, it's better to be cautious and get in touch with your GP. To support your treatment, it's important to lead a healthy lifestyle. Regular exercise like walking or swimming can help keep your joints flexible and reduce inflammation. Also, try to eat a balanced diet rich in fruits, vegetables, and lean proteins, as this will support your overall health. And remember, while Belimumab can help manage your condition, it works best when combined with healthy habits. So to summarise, Belimumab is an effective treatment for lupus, and while it's generally well tolerated, it's important to stay on top of your monitoring and be aware of potential side effects. If you have any concerns or questions about your treatment, don't hesitate to contact the rheumatology team. We're here to help. Thanks for watching.